Wonderful. Well, good evening, everyone. Welcome to the Kingsway Talks COVID vaccines. I'm Brian. I'm one of the priests, pastors here at All Saints Kingsway. Father Patrick is on with us tonight as well. He's the other priest and pastor here. We're really grateful for this partnership formed between Prince Edward and All Saints. We both share a deep concern for the well-being of this community, and that includes all of you here present tonight and all of your family and friends that perhaps couldn't make it, didn't know about it. COVID-19 itself has caused heightened anxiety, fear, and depression and worry for many. Now, with the introduction of vaccines, there is a sense of hope and yet real concern due to the relative speed at which they were developed and approved for our use. I'm really grateful tonight for Dr. Tecimer and Dr. Holland giving of their time and for bringing this idea forward to connect directly with the community in this way to answer your questions about the approved vaccines in Canada. My inbox has been piling up with questions and concerns, and that's wonderful. I've compiled them all, and we're going to do our very best to get your questions answered tonight. You can still ask questions. Just use the Q&A button at the bottom of your screen. Those will come to us directly. You can do so anonymously if you like. Once again, welcome. We're so glad that you're here. Now we'll turn things over to Drs. Tecimer and Holland.
All right, well, thank you so much. We are very happy to be here. We're trying to get the word out as much as possible. And Dr. Holland, thank you, because she had a swamped clinic, so she just jumped on right after. So I appreciate her giving her time for this as well. So we're going to just go on, talk about COVID vaccines, questions and answers. We have some. I'm going to give a brief background, and then we're just going to jump into questions. So now, there we go. Okay, so the available vaccines now, we have the Pfizer vaccine, which is an mRNA vaccine, the Moderna, which is an mRNA vaccine. Those are the two right now that are being given in the hospitals and in the mass clinics and the public health clinics. Astra Zeneca, which is the adenovirus vector, and Johnson & Johnson's being approved and is exciting because it's just one shot, but that hasn't started to be distributed yet. That's what's available in Canada. Okay, so the Pfizer and Moderna vaccines are mRNA vaccines. I have a little thing about this, but I'm not going to go into it unless someone has a question at the end, just because it's a bit detailed on how they work. But it's one of the first vaccines that we had. We started with the Pfizer, then we got the Moderna. AstraZeneca and Johnson & Johnson are adenovirus vaccines. They work in a different way. And we'll learn a little bit more about them. But again, I can go into more detail at the end if there's a question about it. So these are the questions, these are the things that we see a lot of. The AstraZeneca, that's the question, the number one question we get. Should I get the AstraZeneca? What's going on? A lot of confusion about it. Initially, it was not approved by NACI. That's the National Advisory Committee for Immunizations in Canada. And it wasn't approved because initially people over 65 weren't included in the studies, or not a lot of them were. And so what they decided was NACI, this advisory group to Health Canada, they're an advisory group. They decided not to approve over 65 because they were waiting for some data to come from the US in trials, including people over 65, which was just released yet a couple of days ago. And so they decided to hold off on it. But in Europe and the UK, they were using the AstraZeneca for people over 65 in real world. And so they changed it and they said those over 65 can have it because we found that it was quite effective. That confused people. Initially, I shouldn't use it. It's not safe. Now it is safe. It's not that it was never safe. It's just that there wasn't data. But when they reconvened, because they don't meet every day, they reconvene in time, in groups of time, they had a chance to review that data that's being used in the real world. And therefore they said, we're seeing results, we're seeing good results. We can approve it for those over 65 in Canada. So the dosing interval, it's between 21 to 28 days for the Pfizer 21 to 21 days, originally Moderna 28 days, the AstraZeneca between 4 to 16 weeks. In Canada now, they're recommending up to 4 months between dosing. And there's a lot of questions about that. But the idea being bang for your bang for your buck is the first dose. So the most protection you get is from your first dose, and herd immunity means immunizing as many people as possible is very important. By immunizing as many people as possible, everybody benefits. So they had to kind of look at the risk and benefit of that. Then we look at efficacy versus effectiveness. Efficacy is results that you see in clinical trials under ideal circumstances. So there's a test and a control group. The people who are organizing it do everything perfectly. Everyone comes in on time. They make a lot of effort to make sure everything is run perfectly. Effectiveness is what you see in the real world. So they tend to be more of a homogeneous more of a heterogeneous population. So it's not everybody's exactly the same. Some are a bit healthier, some are less healthier. Some are under more stress, some have, don't follow up with their dose. We're looking at the results, what we see used in real world. And that's what's important to us for effectiveness. We want to know what results we'll see in the real world. In Scotland, there were 5.3 million people immunized, including those over 65. And these are not head-to-head trials. They're just whoever got it, they looked at the reduction. Pfizer reduced hospitalization by 89% and AstraZeneca by 94%. So that's very reassuring that we reduced hospitalizations significantly with the AstraZeneca, including many people who were over 65. Then there was a report a few days ago where AstraZeneca was doing a trial in the US, and the data, there was some question about how the data was presented and were they using outdated data. And AstraZeneca said the press release was not completely accurate of the data because it was based on pre-specified data analysis. So they said, we had decided we're going to release the data from this time to this time, and these are the results we got. So Dr. Fauci, everyone knows who he is, said, it's unfortunate it came across this way. We're calling you out on it. We want to see the most up-to-date data, but likely it's a good vaccine. And they're working very closely with the regulators in the US to release that newest data soon, but it's not approved in the US yet. It is approved in Canada based on the data that we're seeing in real world, how effective it is. Blood clots. Everybody's asking us about blood clots. It started out with 15 blood clots, DVTs, deep vein thrombosis. Those are the clots in the legs, or 22 pulmonary embolism if it goes to the lung. Those are very serious. But they only saw that many in 17 million doses, which is less than you would expect to see of these clots in the regular population. So you expect to see about 1 in 1,000 per year of blood clots in the regular population. So this is less than you would see without the vaccine. But once there's an occurrence and you have a vaccine, you have to pay attention to it. The other one that's getting a lot of attention is the cerebral sinus venous thrombosis. There were 5 cases in the UK among 11 million people. And the European Medical Association found another 13 cases reported. They're looking at this very seriously, still quite a low prevalence. And they're thinking that this is most likely in women who are under 55. So something that's being watched in real time. So in Ontario, the goals were to do phases to roll them out. Phase 1, which was supposed to be December to March, was going to be high-risk populations, people that lived in congregate settings, so nursing homes, retirement homes, healthcare workers, Indigenous people, adults who are getting chronic home care, and those over 80. These are the highest risk people, of which we haven't gotten to yet. We haven't completed that yet, but that was our goal initially. Phase 2 is supposed to be starting shortly with 9 million people. And those are going to be adults 60 to 79. And the idea was to be going backwards in 5-year increments. So 75 to 79, 70 to 75 going backwards. Shelter, community living, people with high-risk chronic conditions and their caregivers, people who can't work from home. From age 75 and up, there's now 2 government programs. So those in the hospitals, and then those from the Toronto Public Health, or the public health units. Age 60 and up are at pharmacies and pilot settings of the family doctor pilot studies, or at the pharmacies. And then those who are let me go back here. Those who are 59 and lower, starting to work backwards. Okay. And then health conditions in phase 2. So those with the highest risk would be people with organ transplants, blood cancer in the past year, neurological diseases affecting breathing like myasthenia gravis, kidney disease. Then high risk, obesity, suppressed diseases, intellectual developments, and then at risk, that's 2.2 million. So that's a good chunk of people. Stroke, dementia, liver disease, cancer, respiratory diseases, substance abuse, mental disorders. Pregnancy is in this group as well. Also in phase 2 are caregivers, people living and working in congregate settings, and essential workers. So I got this from a Toronto Public Health site. So this is for the Ontario, the goals for Ontario. And you can see how this is the breakdown of phase 1, 2, and 3. In Ontario, the doses, we've given 1.67 million so far. 2.5% are fully vaccinated with 2 doses, 10% are partially vaccinated. In March 21st, there were 258,000 doses in the freezers. So we want to get that out because we're going to be getting new doses weekly. We want to be not saving things in freezers. Deaths, I always pay attention to. It's our most important outcome. What's of concern to me and Dr. Holland and all healthcare workers, and should be of you, is the age range. It was horrifying when we saw mostly people over 80 dying. And those were people who were living in nursing homes, retirement homes. Now we're seeing more of a spread in younger people. Often it's not uncommon to see people 60 to 79. So this virus is out there and it is killing people. Today, there were reported 1,571 cases. The UK variant, 1,389. So the UK variant is going up. It's very contagious. It's taking over, and we need to be very mindful of that. 10 deaths, 893 people hospitalized. So it's important to know what's the best vaccine you can get, the one you can get soonest. Because the UK variant is taking over, the sooner everyone is vaccinated, the better. Will these recommendations change tomorrow or the next day? Absolutely, because we're going to be looking at what's happening. We're looking at the data, but it's not worth delaying because the real risk is getting COVID. That's the real and concrete risk right in front of us. So that takes me to just a summary and brief. We could go to the questions now.
Dr. Holland, Dr. Tecimer, do you want me to read them to you or do you want to work from the list I sent you earlier?
If you could read them to us, that would be awesome. And
I'd be happy to, for sure. We'll start right at the top. Is there a recommended waiting period before having dental work following a COVID shot?
Not that we know of.
Not that we know of. I haven't seen any, I will say I haven't seen any data to that. And then I also can't think of a reason, like a biological reason why there would be a connection between that. I would think it's actually probably good to get a COVID vaccine before you get any kind of medical procedure done. So yeah.
Perfect.
The only thing that we would just say, beware of, you may not feel well after your vaccine. So you may not want to book something 1 or 2 days later, or just tell the dentist, heads up, I'm getting my vaccine. So if I don't feel well, I won't be coming in.
Okay. If you're living with a person who is vaccinated, but you are not yet vaccinated, can the vaccine alone cause the vaccinated person to shed the virus, even if they have not been exposed to anyone with the virus? I think it's supposed to be maybe spread the virus.
So you won't spread it from getting the vaccine. Okay, so if I have the vaccine, I'm not going to spread it to somebody. It's not a live virus vaccine. I may spread it by not being fully immunized. So at this point, so in Canada, we're saying even if you're fully vaccinated, you should be following all the precautions. In the US, they had said if you have if you're fully vaccinated, you can meet with other people who are fully vaccinated. So you're not going to spread the virus just by being vaccinated, but you should be mindful to keep. So this is somebody you live with, so you're already going to be maskless and whatnot, but you're not going to make them sick.
This question says, if I've received 1 dose of the AstraZeneca vaccine, am I protected sufficiently to spend time with my 18-month-old granddaughter who is in daycare?
Tough one. Cindy, you want to take this? No, I'm just kidding. This is like the word, I hate delivering the bad news. I would say, I think it depends totally on your risk, but I would say right now, no. The answer is it's not a good idea for you to see your 18-month-old grandchild, unfortunately, without a mask and without, being outdoors and stuff like that. I think the AstraZeneca is good. It does, you get good protection from the first dose, but you're not considered fully immunized. And then the other thing that we're still going to be finding out is, maybe at some point kids are going to be vaccinated, or we hope that kids are going to be vaccinated. And so that will offer protection as well. I think everyone, right now, public health guidelines are saying stay within your own household for now anyway. But even still, I think just looking at risk, if this person is older, which I kind of not assume they are, but they're probably over 65, getting the AstraZeneca or close to that, they're at higher risk for hospitalization and getting ill from COVID.
What is your opinion about the efficacy of the vaccine if getting the 2 doses 3 to 4 months apart rather than 3 to 4 weeks apart?
So this is a really good question and a common question. We're getting the first dose is where your most bang for your buck is on the first dose. And the second one is going to be a top up. And based on, so there's a lot of controversy, even among specialists and researchers, should we spread it out? Should we not? Right now, it's most important to vaccinate everybody as soon as possible. So it makes more sense from a public health perspective to get it in arms. Now, there was even something in the Globe and Mail just today that I saw with Isaac Bogach and David Naylor that said, should we be reassessing it? Should people who are older or higher risk, should they be having it sooner? It's going to be like, we're going to be questioning that over time. We're not sure. We have to kind of look from a population-based level, but we definitely know, so that might change over time, but what you definitely know, nobody should postpone the vaccine for hoping maybe if they get one, the delay will be less, because your risk of getting COVID is high. It's high, like that is a fact, a known fact, and the complications of that is really high.
Okay. Thank you. This person says, my concern regarding the AstraZeneca vaccine is that there is no patient continuity receiving it from a drugstore. Once a person receives the vaccine, they do not receive a return appointment, as happens with the Moderna and Pfizer vaccines. They're told the pharmacy will call in 3 to 4 months, and if they don't receive a call, to contact the pharmacy. So is there a concern there about no patient continuity at the drugstore?
Sorry, what was the end part of that, Brian?
So they were told the pharmacy would call in 3 to 4 months, and if they didn't receive a call, to contact the pharmacy. So I think they're just worried about the continuity of following up and getting their second.
Yeah, and I think what I would say is kind of going back to what Dr. Tecimer was saying. So, the bang for the buck is the most with the first vaccine. However, it is important that we complete the series. So it sounds like the person who's put the this question forward is probably able to plan. So I think set a reminder for yourself, put it in your calendar. But I think what Dr. Tecimer and I worry about is patients who may forget or have other things going on. And so this person is totally right. Like, we need to be making sure that we're able to recall patients for the second dose. And hopefully there will be a mechanism. I think, that's the beauty of family medicine. And ideally we'd be in a situation where we could offer it at some point. Yeah.
The bane of our existence in family practice is COVAX. That's the centralized system where you input that data. So they have the capacity. It's just not planned yet. So they will see who's gotten 1 shot and who's gotten 2. So even if you get it at one pharmacy and you get the booster at another, you'd have to use for now, you still have to get a booster of the same type of vaccine, but they have the capacity. So it's very unlikely that people are going to be lost. I think pharmacies can't book you because they just don't know what vaccine they're getting, right? And you may get a follow-up appointment from the hospital, but they just bump it. They'll just email you and say, oh, first people got they got a follow-up appointment, and then it was just bumped. So don't feel like being at the hospital is going to guarantee you your second dose. If they run out, they run out. But we're not anticipating that. I'm worried we're going to have so much vaccine and they're not going to be able to distribute it, which is a problem, because then it becomes inequitable. Then suddenly, just to get rid of it, they're like, everyone, young people, this, that, we want to make sure that the most vulnerable get it first.
Yeah. Thank you. If someone receives the vaccine, can they still be a carrier of the virus?
We think so, yes. And I would say yes. I think what we've seen at first when they came out with the vaccines, they said, it doesn't say anything about transmission or being able to infect others, but they've actually looked and they do think it really reduces transmission. And that makes sense, right? Like that's part of the reason why we vaccinate people. But basically we can't, like this goes back to what Dr. Tecimer was saying about, in the States, they say 2 people who are fully vaccinated can be unmasked. We're for sure not at that point because we're not fully vaccinating people. And so the answer is yes, you can still pass it on. And so keeping up those public health measures, even if you've gotten the first dose of the vaccine.
We can give you a real world, like a good chunk of our doctors are fully vaccinated because we all work at the hospital in high risk areas, and we don't unmask near each other because we work in, close quarters. We still wear a mask all the time. At this point, it'd be great, but at this point, at home, anywhere you go, wear your mask.
This person says, I'm entering my 3rd trimester of pregnancy. Is the vaccine safe for pregnant women? And can you comment specifically about the risk of blood clots, she says, which can be very dangerous for pregnant women?
I'll take that one because I do a lot of prenatal care. Yes, it's safe for women. So the pregnant women weren't in the studies. They never are, right? Because you can't study something on women in pregnant. But what they do is sometimes people are unexpectedly pregnant. They didn't know they were pregnant in the study. So they actually are in the studies. And then they look at real world data. And we found that it's not harmful. And theoretically, it shouldn't be harmful. And it is beneficial because it works. And we know that if you get COVID and you're pregnant, you're very high risk. So in fact, in Canada and Ontario, there was a huge push amongst doctors to make it accessible to nursing and pregnant women. And at one point they said you could do it, but you have to talk to your healthcare provider. And we felt that was very paternalistic because the data is there. If you're pregnant, and a lot of doctors really wanted it because their risk of getting COVID is much higher than their risk of a theoretical risk of the vaccine. Now, the question about the AstraZeneca is an excellent one. I don't know the answer to it. Presumably, if you're pregnant, you're under 65, so you're not eligible for the vaccine anyway. Pregnant women will be in phase 2. I think we're going to wait and see for more data and what the recommendations are going to be based on the numbers that we're seeing. Are all pregnant women going to be directed to the mRNA, or is it going to be safe based on numbers? And then there'll be other places that are ahead of us in immunization, and we'll be following the data with them. But that's an excellent question.
Yeah.
Follow up to that. Sorry, go ahead.
Oh no, I was just gonna, if that's okay, if I could just follow up, just
Please.
Because actually someone asked me a question today and I just wanted to address it, and I've heard it a lot in the media, is around fertility. And so I get this question a lot, and I've seen it in various different places. There is no connection between the vaccinations and having any issue with fertility in the future. And the other thing I just wanted to say, people say, well, we haven't had this vaccine for a long time, and so how do you know? I mean, we have never had, I don't know of a vaccine that has ever impacted someone's fertility. So when you look at the biological basis of these vaccines, it doesn't make sense, like that it would affect someone's ability to carry a child in the future or their fertility. I wonder whether the reason this kind of, I guess, rumor came about was because originally the vaccines weren't, they were saying, oh, you can't be vaccinated if you're pregnant or breastfeeding. So I wonder if that is a connection, but I just wanted to address that there is no connection between that. And yeah, I don't know, Sandy, if you have anything else to add.
No, I'm so glad you brought that up because it's a common question I get all the time. I wouldn't hold back from getting a vaccine thinking I might get pregnant in the next month or two.
The follow-up question to that is around breastfeeding. Can you comment on the safety for those who are breastfeeding?
Same.
This question says there's been talk of AstraZeneca not protecting against the South African variant. Is that something we should be concerned about?
It doesn't protect as well as the others, but right now, as you saw in one of the slides, our real concern is the UK variant. So getting AstraZeneca is better than nothing, but if you have to choose between AstraZeneca and Pfizer and you're worried about variant, you should be worried about the UK variant that's going around, and it's much more effective against that one. So I would definitely not withhold waiting because of a variant. Again, it's more.
Oh, sorry.
I was just going to say real risk versus theoretical risk. The real risk is there, the theoretical risk.
The other thing that I would say is something that I've heard infectious disease doctors talk about is that variants breed where the virus is allowed to replicate like crazy. So we're actually, if we vaccinate our population and with the AstraZeneca, with whatever we can use, we're less likely to have more and more variants that get mutated and become more prevalent in our population. So what we need to do is vaccinate as quickly as possible and do not wait. Get the AstraZeneca, get whatever one is first available to you. I actually don't care what brand people get. I just say whatever one is first available to you.
Okay. This person says, if my first dose is Pfizer, can my second dose be Moderna and vice versa?
Not right now. I just went to a talk where they're discussing that. With the flu shots, we do that. We interchange them. If they're different brands, we don't look at what brand they had. But this is so new. And right now, based on what we have, that's not the plan at all. That might change if we look at what happens in other countries, but right now, no.
Can a person contract COVID twice?
Yes.
It's been reported.
Yeah.
It has been reported, yeah.
Yeah, and also the other thing is that we are vaccinating people who've had COVID, right? So even if you've had COVID, it doesn't mean that you can't reacquire it. I would say, like, I think it totally depends. I think it's complicated. Like, you know, if you have someone like a senior, for example, living in long-term care or retirement home, if they've had COVID, I would definitely, like, I wouldn't count on them being immune to it or whatever. Like, they need to be vaccinated. But yes, the answer is yes, you can get it twice or more than twice.
People are interested, like we've been getting calls lately of saying, I had this cold, I didn't know if it was COVID or it was earlier, you know, when we weren't testing people unless they were traveling, can I do my antibodies? I know I have to pay for it, I'm just curious. It doesn't help, it doesn't change the answer. You still need the vaccine. So you're just wasting money by doing that.
Thank you. This mom says, once the general population is vaccinated, should I be worried about my toddler who's 1 and won't be able to get vaccinated? Should I be worried about them playing with other kids and being around adults without masks and social distancing?
Great question. Do you want me to take this, Sandy?
Yeah.
Okay. I have a toddler, so it's like something really in my mind. So I don't have a crystal ball. I think that the vaccinations are going to be coming to kids. Like, I think that it's going to be happening because even though most kids don't have a risk of severe infection, we know that it can be passed on, as this person said, to adults or, you know, even a grandparent or something like that. And we have seen increased transmission in schools. So I think it is something that's going to be down the pipeline. I don't know, like, I'm just guessing, like, based on what I think, and it's not like known or anything, but I think that when that time comes, I think kids are going to be vaccinated at some point in the future. And I guess it goes back to the public health guidelines. I would say, like, for sure right now, especially, like, kids should be wearing masks and, you know, physical distancing, playing outside if they're playing, you know?
Okay, thank you. This question says, will my doctor be advised by the health authorities when I'm vaccinated, or should I advise my doctor?
They're working on that through the EMR. So they're looking to see if they can push, everything gets inputted into COVAX, which is that centralized system. So they're looking and seeing if there's a way to push that into our system. I think I wouldn't call the doctor's office now to say you've got it unless they reach out to you like through a mass email or something saying, let us know. But keep that information. And when you have your next appointment, say, I got this vaccine at this date, and they'll put it into their chart.
What happens if Canada does not get enough vaccine in time for second doses? What would be the efficacy of getting just the first dose? You've talked a little bit around efficacy already.
Very good. Very good.
Yeah, and I wouldn't hold back.
Get the
I
shot.
think that if you don't get your second dose on time, like get the dose. And I actually completely agree with Sandy. I think what's going to happen is we're going to get a whole whack of vaccines, and it's going to be a question of how we distribute the vaccines quickly and efficiently. And so, yeah, I think we're going to have the opposite problem, or not a problem, but the opposite situation.
Logistics, yeah.
This person says, I take medication for blood pressure. Is this a factor when considering AstraZeneca?
Yes, it means take whatever vaccine you can get sooner.
Oh. I was like,
yes, it means you're higher risk. You may have some heart disease. You want to be vaccinated right away. Yeah.
Okay. I think that's all the questions from the list. Patrick is going to take some that have come in on the Q&A side of things.
Thanks, Brian. We've had a number of questions come in while we've been answering questions. One question came in. I've had a blood clot in the past caused from birth control pills. Should I be worried about the vaccine? I'm 74 years old.
No, you should be worried about getting COVID, because if you get COVID, your risk of a blood clot is 2%, which is much higher than 50 and 17 million. And the Thrombosis Canada has put together a nice statement about that, saying that you shouldn't be held back from taking AstraZeneca if you've had a blood clot in the past, if you have a family member that had a blood clot. Those are not reasons to withhold, because you're even at higher risk of blood clot. You want to be vaccinated so you don't get COVID, so you don't get a blood clot.
Okay. Next question. I take blood thinners for AFib. Is AstraZeneca still okay for me?
Yep. Yeah, so I think Dr. Tecimer and I did some vaccinations in a retirement home, and on the list, on the consent list, there's do you take a blood thinner? And I don't totally understand why it's there, to be honest. I don't. And so I would say, when you get an injection, you might just need to put a bit of pressure on the area. But yes, the answer is you can get any of the vaccines that are on the market currently.
Sure. Thank you. Next question. If I, a female age 65 years old, if I'm allergic to shellfish and other environmental allergies, dust, mold, mildew, pollen, ragweed, should any of the 4 vaccines be avoided?
That's a good question, because when they first did the study, when they first did the injections in the UK, there were a couple of healthcare workers, or a couple of severe reactions. And they said anybody with any allergy of anaphylaxis, you shouldn't get it. But they've since reviewed it. And if you have an anaphylactic reaction to a component in the vaccine, then you have to do it under, an allergist care. But any allergy to food, to medication, if it's not a component of the vaccine, it doesn't withhold you from taking it. It does require that you have to have observation longer. So you do need to let them know when you go to get, wherever you get your vaccine, you let them know I have an allergy to this and that, and they'll be monitoring you very closely, but for 30 minutes instead of 15.
Okay, thank you. Another question. I got my first shot on March 21st. My second is scheduled for July 11th. If there is more vaccine available, will that happen sooner? Will the time between sort of shrink?
I don't know the answer to that. Maybe. I would say stay tuned. We really don't know what's going to happen with supply. So yeah, I don't know.
Okay. Next question, and more are coming in as I'm reading them. My daughter is expecting her second child. Her first child is in daycare. I have heard that 2 weeks prior to my daughter's expected due date, the toddler should be pulled from daycare. Is this something that you recommend?
That's not a, I mean, like because I do a lot of OB, so I do a lot of deliveries, and that's not something we're telling our patients who are delivering to pull. I think maybe the idea is that if they get exposed, it's going to be a hassle because, you know, when she goes to hospital, I don't know if that would be a across the board recommendation, because you still have a life, you know, like it's you still have to, you know, you have to work and or do something else, and you have a child in daycare for a reason. It's not just to pass time. So I don't know that to be any official recommendation. I think that's more just in theory, should they pick up the virus and then spread it. Dr. Holland, do you know, is that something you've come across at all?
I'm sort of like I have a question. I don't know if maybe there was a question of like maybe like the grandparent, whoever wrote this question. I wonder if they're like elderly and whether they're going to be helping out. And so the question is that will the, like, if you do a 2-week kind of quarantine sort of before the grandma is going to be really involved. Like,
Sure.
I think it depends on, I think, their health conditions and stuff like that. But it's like, I think daycare, they're taking precautions, they're doing public health measures. I think it's really an individual kind of thing, but I agree, it's not an across the board kind of recommendation. So
Yeah, that's a great point. If the grandparents are going to be helping out watching the kids and they want to reduce their risk, they could do that if there's asymptomatic spread or whatnot. But yeah.
Sure. Somebody has a question around the safety of the vaccines more generally, being such an expedited process rather than a sort of a long drawn out process as we're accustomed to, I guess, more collectively. And then a follow-up question on children's vaccination. Will it be put through more rigorous testing than what has been?
great question. I think, you know, for me, I felt like 9 months was like the longest 9 months we've waited during the pandemic. So I think it's all about perspective a little bit. I guess when I look at the vaccines and sort of how quickly they were put to market, I think what I think about is actually the whole world was working on this, right? So like a lot of research and a lot of things actually went on pause. And so all of our greatest minds were working on coming up with a vaccine. The vaccines have been rigorously tested, and I would expect no less for children. I mentioned children because, you know, they aren't included right now in the vaccination process, but we know there are people in our population, children who are at risk. So children for themselves, but also that could pass it on. So I think I trust the science, and these vaccines have been rigorously tested. Yeah.
Okay.
And the mRNA, for example, it's being used in other things. So it's not that the science is completely new. It's just new because the virus is new, but they've been using it for some sort of cancer treatments, for genetic treatments. So it's not completely new. They just kind of shifted it.
Sure, that's helpful. And I guess another question came in and it follows up on that. Going back to your first 2 slides that you said you would go sort of quickly through, somebody would like to a little more explanation as to the difference between the 2 types of vaccines and how they kind of work.
For sure. Do you want me to do that now, or do you want me to leave that to the very end?
Maybe let's wait till the end and then
Yeah.
we'll go through that. Sure. One question: if in July the adults in my household are vaccinated and the adults in my sister's household are vaccinated, can our households get together inside, unmasked, with our young kids 3 and under? I think that's everybody's question.
I think that's everybody's question. And I think we're going to have to see, like, I think you're going to need a certain number of people vaccinated. And then they're going to give recommendations based on the numbers that we're seeing, right? If the numbers are low, do you remember last year, like the first round, it was you could bubble with 1 family. Mm-hmm. So I guess we'll have to see what happens. It really is going to be dependent on what's the circulation, what's the death rate. Mm-hmm. You know, eventually we're going to be going in that direction. That's the whole point of vaccination, but we wouldn't be able to tell you that now.
And I would say, like, just to add on to what Dr. Tecimer was saying, so part of it in this particular question is about the individuals. So who's vaccinated, who's not vaccinated, that's part of the story. But then the other part of the story is what is the risk of transmission and what is your risk in the population? So if there's tons of COVID going around, your risk, even though you're vaccinated, you could still be passing it on because there's so much virus being passed around. If community transmission is low and everyone's vaccinated, you're at a lower risk. But again, we're not going to be knowing the answer to that right now.
Okay. Another question. I know you spoke earlier around the AstraZeneca and the risk of blood clots and some of the things we've been hearing from Europe and that sort of thing, but would wonder if you would comment on Health Canada adding AstraZeneca blood clot warning. Which is in the news today, I think, or yesterday.
Oh, is that okay? I have not even looked at the news today. I've been in clinic and then I came here. What was the blood clot warning? Are we able to pull it up? Maybe I can answer another question while you can. Hold on one second. Let me see.
There's a question about travel. If you want to, the safety of kind of travel after the first dose of a vaccine.
Okay, I'll answer that while Sandy's looking up the AstraZeneca stuff. So, yeah, so I mean, I think it depends on what kind of travel. So people have been traveling throughout the pandemic. If it's like either like necessary, you know, I've had patients who've had, you know, deaths in their family or other reasons that they need to travel, sometimes for business or what have you. So some people are traveling, you know, without vaccination regardless, or doing sort of like public health measures, getting the COVID test, all of the stuff that you need to do. I would say, you know, does the vaccine give you a little bit of extra protection? For sure it does. Would I say that, yeah, you can go travel wherever you want? No. I still wouldn't say that it's safe to travel in that way. I don't think we're going to be there until more of the population is vaccinated.
Okay, I think I know what we're talking about here. This is, okay, so that Health Canada warning is related to that rare, the venous, the sinus thrombosis. So it's just saying that they're those rare things that we're watching. So they're not telling people not to be vaccinated. And this tends to be in the younger women. Everyone they've seen it so far tends to be on the younger side in women. So I think that's just something to be aware of. But that doesn't change anything that we've been talking about.
Okay. Brian, do you see any other questions? Because
I think we've got them all so far.
That was a lot. So
I think if it's okay, I think I actually have to see one more patient. I think I have to call someone. So I might just jump off just because they were expecting me at 8 and I kind of feel bad. So I should go. Is that okay?
Yeah, thank you so much.
Thanks, Dr. Holland.
Thanks very much. Okay. Bye.
Bye-bye.
So I'm going to pull up my slide here. See, I need the kids to start being able to work on just how to use Google Slides. I don't know when they surpassed me, but it started. And it is very emotionally degrading to have to do it. They're not kind about it. Okay, so let me just pull up here. Here we go, COVID vaccine. See, I don't need them. Pull it up here and then go to present and then share screen. And
just a reminder to folks too that as we continue, they can still add questions to the Q&A, and we'll try to address them before we finish.
Thank you. Okay, so the Pfizer and the Moderna are the mRNA vaccines. So usually what happens is you have DNA, and then DNA in your bodies, DNA makes mRNA, it's messenger RNA, and that gives instructions to pull the amino acids in your body to make proteins. Okay, so for this mRNA vaccine, which was the first one, What they did is they took the mRNA, okay, and they inject the mRNA into your body, and the mRNA is to give instructions to your body to make a spike protein, and the spike protein is on the shell of the COVID vaccine, of the COVID virus. So what it's doing is creating part of the COVID virus. It's telling your body, create part of this COVID virus. And when your body sees this COVID virus, part of this COVID virus, the spike protein, it says, this is weird, this shouldn't be here, and it makes antibodies to it. When it makes these antibodies, your body remembers it and it goes into your T cells. So your body remembers it. And then the next time you see a spike protein, your body says, this shouldn't be here. And you already have antibodies ready to go to mount a response to it. So the next time you come across this virus, your body is ready to fight it. So what they've done is created the spike protein. So part of the coronavirus, it kind of looks like a circle with these spikes coming out. They created mRNA to turn into protein that looks like that spike virus. So your body fights it so that when you actually come in contact with the virus, your body's ready to fight it as foreign. It recognizes it as foreign. For the AstraZeneca, it's a weakened adenovirus. So an adenovirus is a very common cold virus that we see. They took them from chimpanzees, I believe. They take the DNA material out, okay? And then you have the viral shell. So they take the stuff from the outside, they leave the viral shell, okay? And then from that DNA, they work on that DNA, they take out the stuff that allows the virus to replicate or the parts of the virus that make it sick, okay? They use the part of the DNA, they use part of the DNA that makes the spike protein, the same thing. So it's like one step up. Instead of using the mRNA, it's using the DNA, putting it back into the shell and then putting it into the body. So again, it goes into the body, it goes into your cells. Your cells say, oh, there's a protein here, a spike protein. I don't know what this is, but it doesn't belong here. It fights an attack to it. But the next time that you actually see COVID, the virus, your body is ready to attack those spike proteins, and that's how you mount the response. Now, I didn't say it as nicely as this guy, Rob Swanda, does. He is a really nice, I think he's a PhD student or something, and he has a very nice, these diagrams. So if you Google Rob Swanda, SWANDA, on Twitter, just do Rob Swanda Twitter mRNA or DNA viruses or adenovirus. He has a very nice 2-minute description with pictures that he draws that describes it very nicely. So if you want a little bit more eloquent description of it.
Wonderful. Thank you so much, Dr. Tecimer. There's one participant who's raised their hand, and I see that your hand is raised, but if you have a question, I need you to type it into the chat or the Q&A. I don't have anything to do with raised hands, unfortunately, on the webinar. I want to get to you, but you'll have to type your question out there.
Sure. I have just a quick question, Dr. Tecimer, around the Johnson & Johnson vaccine, and it's been approved, but do we have any sense of when it will be available?
I believe initially when we heard about it was going to be closer to September, October, but I'm not sure. I'm not up to it. The nice thing about it is it's one shot, which is amazing.
One and done.
Yeah. So that'll start going to the mass population who's more low risk.
Okay.
Wonderful. Well, I don't see any more questions coming in right now. So Dr. Tecimer, we really want to express our thanks to you so much.
Thank you. I really appreciate it. I really encourage people. I know even my own parents are asking, what should I do? You know, my dad is 75. He's going to get his at the hospital just because that's where he's 76. That's where he got the first appointment available. And it was the fastest one available. My mom, the first one she could get, she's younger than that 75 age group. She's going to get the AstraZeneca, and she has severe lung issues. So I'm very interested in keeping her in good shape. And the most important thing to me is she's vaccinated yesterday. You know, I don't want to wait a few, you know, because she's 71. So I'm sure they appreciate me sharing their ages with everyone, but she's 71. She has severe lung, you know, so sometimes people are like, maybe she should wait for, you know, a few weeks because she's just a few years off that, you know, they might extend it. I don't care. I want her vaccinated yesterday. And one thing that really resonated with me, we're part of like a doctor's mom's Facebook group, and people are asking for their own parents, people who aren't following this so closely, because you could be a, an obstetrician or, someone that has nothing to do with vaccines. What should we do for our parents? And one person said, my mom died in October, and all I could think is, if only she had the vaccine 2 weeks earlier, it could have been, and that really brings it home of, I would have given her any vaccine if she had had it 2 weeks earlier. Maybe she would have gotten sick, but maybe she wouldn't have died. And really, we are seeing death. So it's not a scaremongering thing. It's just that we know it's a real threat. We don't know when we're going to see it. We know that the variant is really circulating. It's very contagious. You're seeing more sick people with it. So the sooner you can get any vaccine, the better.
How's your petition going to be able to hold a clinic?
It's an excellent question. We want so badly to hold the clinic. We did hold we've promoted it. There's a lot of political stuff involved with it. We just did it as a grassroots. We started, Dr. Holland and I, we want to get our homebound patients, right? Because they're not going to get anywhere. They can't go anywhere. A lot of them, if you're 95, your child is like 75, right? Like, it's not easy. So that's how we started it. And even now we see a lot of people who are 80, 75, they can get to the mass vaccine clinics, but they're afraid to go. They don't want to go. Or they can't walk that far, and we want everyone vaccinated. So the petition it's gaining. So if you are able to get more signatures, it just gives us weight. Right now, they had offered us to be a pilot site, but what we need to make it sustainable is we need someone to help with COVAX. So we're very good at doing mass vaccinations, and safely. Even in the fall, we did a flu shot vaccine clinic for anybody who was under the age of 5, because they couldn't get it at the pharmacy. So we did an outdoor clinic. So we have the logistics planned out. But the COVAX, although it's very good to centralize everything, it's very cumbersome to input data and whatnot. It can be done. Like, we did it at the nursing homes. We just did it on paper. Then we sent it back to the hospital and someone entered the data there. So we just need that support to be able to do it. So if you have any say with anyone, say we want to do it with our family doctor's office, because it would be easy. I even thought, like, I could say, like, it would be nice to, have a relationship with you guys where you could line everybody up, and we could just go boom, 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 give all the shots, do it on paper, send it to public health to input the data, because you have this space, you just put 2 meters between each person in the pew, next half hour, go. There's really creative ways to do it, but there has to be sort of political will and weight behind it. So we're still trying, because we're saying, let's do it as a pilot site where we can have that done to do more shots. But so far we haven't had luck in convincing the powers to be.
For sure. Okay. Well, we're going to send out the link for this recording tomorrow to those participants who registered. So maybe we could also link the petition that you have.
Oh, awesome.
Would like to sign it.
Yeah, that would be great. Thank you.
Wonderful.
Thanks so much for having us. It really is, it's great to spread the word as much as possible.
It's been really good. Thank you to everyone for joining us. You'll get an email from us tomorrow with the link to the video on our YouTube channel. Have a good night. And as Dr. Tecimer said, get your vaccine, whichever one it is.
Take care. Good night.
Good night, everybody.
Thank you.
Bye.
Good night, all.